Nebraska, and I'll throw this out for all four of you. How long before you decide to fire half yourselves and actually have a unicameral? Because it works. There's 49 states that seem to think they need to pay for twice as much leadership as what they actually do. But coming from Nebraska, I tell you, the unicameral works. It's a little different rules than what you have here. But I'd be interested in hearing what your comments are on that. Oh, let's have an introduction here.
Okay. I apologize, Representative Ron Creasher from 9B in Little Falls, Todd County. I'm also from Nebraska, so I do have a perspective.
Ah, so maybe you could offer.
Where are you from?
Omaha.
From Columbus. So.
Oh, yeah.
Omaha.
90 miles west.
Yeah, Omaha is the east metro of Nebraska. So.
Yes.
But I've gotten to know many of the senators in Nebraska, and Nebraska has some interesting rules with the unicameral. I'm not necessarily convinced it's as wonderful as everybody says it is, for a couple of reasons. Number one is, one of the things in Nebraska, because we only have senators there, is they cover such a vast area. And when you cover such a vast area, you don't have as much touch with your legislators. To have a panel like this is fairly uncommon in Nebraska, especially when you get out to western Nebraska, because you're covering such large spaces. The Omaha and Lincoln folks are great because the legislators are there all the time, and they're right there. They're in your backyards. Where we were out in Columbus and further where I farm, you almost never saw your senators. The other thing about the unicameral that most people don't understand is the second house of the unicameral is considered the people. So every senator gets 3 bills. They get to bring those bills in. The sessions there only last 12 weeks. They're on, they're done, you're out. And you bring your bill up and everybody gets a hearing on it. So sometimes you get movement, sometimes you don't. Whereas we have a committee process, a vetting process, and it's just unique. If we want to run it just on costs, that's one thing. We could cut one of the houses here in Minnesota and just get rid of the cost. But that comes with an expense. Remember, the Nebraska senators get $12,000 a year. And because of that, you get college kids or really high-paid lawyers and doctors. If you look at their senator representation, there really is nobody in the middle.
Right.
And so unicameral is great. It's wonderful on Saturdays when we have football games and everybody goes down to Lincoln. But I have to tell you, from a businessman who's come to Minnesota, the representation of the House of Representation and the Senate, while it seems overbearing and it seems onerous, it works. And it gives us the ability to do things like this and work very closely. I get in and out of businesses all the time. Whereas in Nebraska, as a businessman, to have a senator come, it just wasn't going to happen. So that's my perspective.
Okay.
I was going to say that too. With representatives, it's just like being a mayor. When you're a mayor in a small community, everyone has personal contact with you. Representatives, same thing. We have close contact with our constituents. I get calls all the time. And I thought this was a retirement job. It's a 7-day, 24-hour-a-day job. You work all the time. You get calls all the time. And I guess that's the part when you're a representative, you have close contact with people. Where Nebraska, you don't have as many people for one thing.
No. There's more people in Minneapolis and St. Paul than there is in Nebraska. Enough of that, I guess. Do we have other questions from the floor? Question that's coming up, and that several of you have alluded to it in different ways, is that whether you want to call it the new healthcare law, or more importantly, what's going on with Medicaid at the moment, that could be a real budget problem for this state. Now, Paul, you alluded to the fact that we're going to cut out, thankfully, the 2 new sales taxes, the storage sales tax, which is, for most of us businesses, we can't pass that cost on. We have to soak it up one way or another if you don't repeal it. And if we're going to do that, we're going to find other ways to cut costs. Usually that means bodies. The other side of it is on the egg. They can't pass their costs on, and there the commodity market is not doing what it has been doing the last few years. You just can't ride that bubble forever, as we saw in 2008 for manufacturing. So we cut out those additional revenues, yet we know that there's going to be additional costs coming through for the Medicaid side of things, especially with our aging population. So what are we going to do to help offset? Because you can only cut so much before the state's not functioning where people think it should be functioning. Yet how do you take and raise the additional revenue or cut the costs? Any thoughts? That's a lot.
Yeah, there's a balancing act here. And that's where the two-party system comes in. I think you've got two different major philosophies on how much government should provide services. Some feel more government is better. You know, I think the Constitution says the government has to provide education and transportation, and I think that's really about it as far as what's mandated. But we've delved into a lot of different areas of government, and therein lies the discussion of how much is too much, how much is not enough, and there's a disconnect sometimes with the general public feeling that the government does it, but it doesn't cost anything. Well, whatever the government does has to be paid for some way or fashion. With the Affordable Care Act, there's insurance options for people who can't afford it currently, but it has to be paid for somehow by increased taxes on capital gains or whatever. There's no free lunch any place in government. It has to be paid for by the taxpayer.
One thing.
Okay, next.
Okay, first of all, on the health exchange, the decision if we're going to have Obamacare or health care exchange, that was made in Washington. In Minnesota, the decision we had to make is it going to be state-run or are we going to let Washington run it? And the decision was made to have a state-run health care exchange, and I think that was a wise decision. I think in Minnesota we can do a better job operating that than Washington can. On the question of expanded MA or early MA, actually up front that will save the state money. And the reason is up front the federal government I think is going to pay all of that. And then as we go through time it's going to start backing down. I think they're going to go down to 90% in, I forget, in a certain number of years. So in Minnesota we will actually save money. It'll add leave the bottom line in Minnesota in better shape. Now you look further yet out into the future, there's some concern, well, can the federal government keep paying this bill? Maybe at some point in the future they're just going to pull out, and then here we sit as a state, what do we do? Well, this question was brought to the courts, and the courts said this is voluntary. They can't force anybody to do it. And so if in the future at some point that does happen, Minnesota can just pull out of it, and we don't have to be burdened with that cost at that point. Right? So that, if that happens in the future, some future legislature would look at that and make that decision. But up front now, our state budget is in much better condition because we opted into the earlier expanded MA.
Any other thoughts on this?
Yeah, I would just say, when have we ever gone backward on a program? So if we get into this, and we are getting into the expanded MA, the feds say they're going to pay for it, and if in fact they can't down the road, it's going to be awfully difficult politically for any legislature to tell 100,000 people, you're off now. We're going to send you back to where you had no coverage. So I think once you're in, and I have a big concern about the government in Washington continuing its level of coverage. They've done this with special education. When they mandated all of the coverage for special ed, they promised to pay 40% of the cost of special education. Currently they're paying about 17%. So their record is not good in terms of what they follow through on with their promises. One last comment on the competition part in the healthcare exchange. It was actually said on the House floor that we don't want too many plans in this exchange because the insinuation was people are not smart enough to make their own decision. It's too complicated. It's too hard to find out which policy is best. So we know best for you. We'll pick out I think there's 9 companies right now that are going to be on the exchange with plans. But this idea that government knows best and they're going to pick the plans best for all of us in Minnesota, I just don't agree with that.
Okay, I won't add too much because that covered both sides very well. But remember the quote, "A government big enough to give you everything you need or want is also strong enough to give you everything, is also strong enough to take away everything that it gave you." And this is exactly what the Affordable Care Act is going to do. As you can see across the nation, employers are now limiting the hours that they are going to hire and reducing hours in their workplace to get underneath the mandates that this program is putting into place. So in front of our eyes, this nation that was built upon 40-hour work weeks is now becoming a part-time nation. You can talk about now, think about our families that are already struggling to get by on 40 hours, due to the sluggish economy. Can you imagine a family having to work 2 and 3 jobs? Think about, we have a real issue here with families staying together. So many parents are not getting married. So you've got moms and dads singly raising their children. Children spend a lot of their times in early childhood education until they get to school. This part-time nation stuff is only going to make matters even worse. Think about that mom that's now going to have to work 2 or 3 jobs in order to pay the bill.
We've done it. We've created a health care exchange, which puts out a number of different health policies that you can choose from, which makes health insurance competitive. When you make things competitive, you should lower pricing. That's one thing we need. Every Minnesota citizen wants a good paying job, good health care, and good education for the kids. And I think we deserve it. And the health care exchange is one way to help lower health care costs. It's supposedly helped to benefit, and Lyle, you can correct me, $1 billion for our state this coming year once it becomes usable. It starts October 1st. So it's MNsure. Go on your internet, take a look at what you can find for yourself. That's the single most important thing. Healthcare, affordable healthcare is something that is necessary for a good state.
Right here?
Yeah. Go ahead.
No, Ron, you go first. You're the new one.
I'm going to touch on what Representative Anderson and Representative McNamara said. McNamara, sorry, Jim. I should know that.
That's okay.
Everything he said, in theory, makes sense. We all want a certain standard of living, but it's not government's job to define that. It's not government's job to define the bottom and the top end, which is what we're trying to do right now in government. We want to tell you how rich you can be or how successful you can be, and we want to tell you how poor you can be, and you can't do that. That's just not what government's role is. I have a real issue with the Minnesota Health Exchange. One of the reasons is the term that's tossed around by my other side, health care. It's not health, they say health care, it's health coverage, folks. There's a big difference. We're talking about the level of health care that we're going to mandate for people, which means everybody should be able to have their knees replaced. Everybody should have their hips replaced, no matter what your style of living is. Everybody should be able to have access to, and you do. In this country, we all have access to it. But you know what? It's not fully equatable. Based on how decisions you've made and so forth, you have different levels of healthcare access. The other thing is also the competition thing. Okay, you guys are business people, men and women are business people. You know, if you want competition, you have to have competitive costs as well as market players. Okay, we already have insurance companies that are pulling out of the exchange because they know that these are going to be the most costly recipients of health coverage. They know that. Would you go take your most expensive customers and say, I'm going to bet the farm on them? They're not going to do that. And then the government comes in and says, you know what, we're going to start with an $80 million organization, and oh, by the way, we're a little short, we're going to go ask for $55 more million. And so suddenly you have this, which, as we all know, is a cost. On that side of the balance statement, that's a liability. So I have a hard time seeing that the costs are going to come down. We're insuring the most costly people. We're adding the most cost to it. And oh, by the way, you're going to be responsible for it. I'm going to be responsible for it. We already know there's an additional 3% fee that's on top of this. We're not living in the world where you can just make money and print it in your backyard. So I have yet to see that. And you know what? I hear the competition. I hear the competition. Do you want competition? Go online. There's plenty of competition. You can go do your own research. Go to your local insurance agent. They'll go out and shop these rates for you. The competition is there. The challenge is government is deciding a segment of people and saying, you're not getting what we think you should get or what everybody else is getting, therefore we're going to pay for that, i.e. pass it on to people. So that's the problem I have with it. I have a hard time seeing this competition argument when people are pulling out, insurance companies are pulling out and saying, we're not going to insure them. We know that's the most highly cost recovery recipient.